Hi everybody, this is Ash, your buddy and fellow nurse, and today we'll be talking about something very interesting and something that I like a lot, and that is silver nitrate. What is silver nitrate? Silver nitrate is a silver product that comes in something like this, and it comes in a box where it is protected from light, so that this portion has silver in it, silver nitrate to be specific, AgNO3, and we use this for hypergranulation or a wound that has rolled edges. So I did not get the proper picture for the wound, but any wound that has rolled edges or there is hypergranulation, you can use silver nitrate on it, and I will show you how to do it so that you know the right way to use silver nitrate. Silver nitrate is a cauterizing agent. It's a chemical, I would say chemical cauterizing agent that burns and kills that specific area that you touch with it. For procedures like this, I will always have normal saline with me, and the use of normal saline for silver nitrate is very different from what usually we use normal saline for. So I'm just gonna keep this on the side because it's a separate use for this. You can use Vaseline or any emollient that the patient has or you have it at your facility, and you will need sterile water. So I don't have sterile water with me at this point, but we'll assume that I have sterile water with me, and we will just get into the procedure. So as I told you, silver nitrate comes in these small like sticks, and it's protected from the light, and it's kept in a dark container. So if I want to burn these hypergranulation, this is an exaggeration of hypergranulation that the ChatGPT made for me, and rolled edges. So what is rolled edges? The wound needs to have proper edges for it to close, but when the edges get rolled, so it will not close but it will roll into itself, the wound remains open. So we need to get rid of the rolled edges so that it comes across like this and it closes. If you imagine a wound closing in this way, if it is rolled, it will just roll and it will not close properly. And any hypergranulation, so we know that granulation is the red beefy tissue that we always talk about. Hypergranulation is a tissue that is on top of it, and the main cause of hypergranulation is when there's excess moisture. When there's excess moisture, there can be excess production of these cells that are fragile and that breaks apart, and those are not healthy tissues, and we have to get rid of those so that the healthy tissues can fill up and the wound closes fast. So to get rid of those, I can use silver nitrate. I don't have it covered in the dark container that it comes in with, but I just brought this sample from the hospital just to show you, and this is how it looks like. And this portion, the dark portion that you see, that has silver nitrate in it, and it deposits the silver and burns the tissues right away. So if I'm going to do a procedure, what I'm going to do is I'm going to wash the wound with sterile water. Please do not forget, do not wash the wound with normal saline. We do not wash the wound before we do the silver nitrate procedure with normal saline. Normal saline deactivates the action for silver nitrate. So I'm going to repeat that again. Normal saline deactivates the action for the silver nitrate. I'm not going to wash the wound with this. I'm going to either wash it with sterile water, or should not say this, but if the sterile water is not available, you can also wash it with clean tap water. Once I've done that, what I'm going to do is I'm going to take the emollient or any Vaseline or anything like that you have, just to protect the skin. In case I touch other parts of the skin, it will also kind of get burned, and we don't want that to happen. So I'm going to take a swab and I'm going to apply it around the wound, thick layer. So even if suppose I'm I'm working with silver nitrate and I sneeze, I might touch other portions of the wound or outside the wound, and I don't want that. So I will cover that just for protection. If you don't have this, it's okay. This is just an added protection. You apply it on the outer layers of the you apply it on the peri wound, and what you will do is, with your steady hand, what you're gonna do is, your nurse steady hand, you're gonna apply this on the hypergranulation tissue. And as I said, if they have rolled edges on the wound, what you will do is you apply on the roll edges, and once you apply, you can see the silver starts to get deposited. It gets black and dark. If I'm doing rolled edges, I will always try to use a Vaseline. The reason is I might touch the peri wound area, and I don't want to do that. Once I do that, I have to, and it works. It starts to burn it. What I'm going to do it, I'll wait for 1 to 2 minutes, and now I have to deactivate it. And we all know that it gets deactivated with the help of normal saline. So what I'm going to do is, after I've done this, I wait for 1-2 minutes. Now I know the cells will die now. I'm going to open this, and I'm going to wash this with 120 ml of normal saline. Usually we don't get 120 ml, we get 118 ml. That's okay. 2 ml is not going to make any difference. And then we can do the regular wound dressing that we do. So this is all about silver nitrate. Please remember a few things. Always clean the wound prior with the help of still water, and then apply. You can protect the skin with the help of any emollient or Vaseline, and wash everything off with the help of normal saline, our best friend. I hope you liked the video, and thank you for watching.